Dr. Mohamed Faisal Elsheikh is the spokesperson for Sudan Doctors Network. He joins us live now from Manchester in the UK. Dr. Mohamed, thanks for being with us. So this was a stark warning report, that the Doctors Network put out. Can you just give us a little bit of an understanding of exactly what is going on in terms of the violence and the warnings that the Doctors Network did describe in that statement?
So what's happening is actually absolutely terrific. Things are getting towards more aggression. RSF is committing more and more atrocities and violations against the civilians of Al-Fashir. As you probably are aware, Al-Fashir was under massive blockade and siege by the RSF for the last 550 days. Within this amount of days, there were no food, no medicines allowed to go into the city. People were struggling a lot. Health system was collapsing. The health system over there is working only with 20% of its capacity. Malnutrition rates are increasing rapidly. We having a high rate of mortalities among children and pregnant ladies, as well as the geriatric community. In addition to that, RSF committedly kept air striking and artillery shelling the hospitals and the medical centers, and actually even the shelters for the internally displaced refugees multiple times. So last Sunday, when they invaded the city, they committed a horrible, terrific atrocities across the civilians in Al-Fashir. For those who knows the background of the conflict of Al-Fashir, there is always an element of an ethnic issues. RSF is always tend to be non-humane towards the people who are not from the tribal communities, and we have seen that clearly. They've been executing people with the cold blood in the streets without putting any measures to the international laws, to the Human Rights Acts, or any of that. The most recent reports and the footages, which are actually published by the RSF accounts themselves, showing a terrific attacks into the hospitals, going into a Saudi hospital and Al-Fashir hospital, killing the inpatients and killing the people in the outpatient area who are wait to be seen in their clinics for their medical consultations, killing the companions of these patients in the hospital. So this is completely inhumane. This is completely unacceptable. This has to come to an end. People in Al-Fashir, they've been struggling for the last 550 days. Silently, no one knows about their struggles. However, this has gone beyond the limits, and now the international community needs to make a move. They need to make a positive steps towards stopping these atrocities for these civilians in Al-Fashir.
And Dr. Mohamed, the executing that we have seen in the last few days of civilians as being reported in Darfur, in Al-Fashir, this has been warned of for some time by rights groups. Many months into the civil war, this has been warned of. Could anything have been done to prevent what we're now seeing?
So, I mean, if the United Nations conditions been applied in the floor, this would have protect a lot of things. At least the country in a war status. So, but if the RSF just respect the laws, the war laws, by not getting the civilians and not getting the medical staff and the journalists and all these people who are doing their works in a very difficult situations, if they can just protect them, if they can keep the civilians out of the equation, RSF problem isn't with the supposedly. I mean, I'm saying just assumingly and supposedly they shouldn't be having issues with the civilians. It's just only with the army people. So now we have seen the attitude and the behavior of the RSF when they were like controlling Khartoum state and Al Jazeera state and Sinnar state. We have seen these atrocities as well, unfortunately, over there. And then people at that stage realized like these forces, they're actually targeting the civilians as well as the army forces as well. And now we have seen a horrible picture happening in Al-Fashir, killing people like with the cold blood without any reasons. It's just because they are not part of their community or tribal components. This is really sad. I think the best way to stop that is just the international community has to make a move. They need to make sure we need to have like medical and urgent, actually medical and humanitarian aids to the area, just to prevent whatever we can prevent and to solve whatever can be sorted. To be honest, the situation over there is already horrible. Uh, People are struggling a lot. Mortalities are gone up through the roof. Even before this last attack, we used to lose 3 kids every day in Al Fashir due to malnutrition. So I can't believe we are in the 21st century and we're having people die, our kids die because of malnutrition. This is really sad. We have like an uprise in the endemics over there, as well as the cholera and malaria, as your correspondent mentioned. So the situation was already fragile before the last attack, and now things are gone even worse. So we have in our last reports from the ground over there, we estimated the people who are displaced from Al Fashir to Tawila around 15,000 people who they managed to escape from the city to go to Tawila. Tawila, the situation over there was already fragile, and we know that for sure they wouldn't be able to tolerate this massive influx of people coming in by providing them the food, the shelter, and the basic medical needs. So here we are putting an appeal to the international organizations and all the international community to help in providing the medical aids and the humanitarian aids. At least that this would help in easing the situation a little bit, maybe.
Dr. Mohamed Faisal Elsheikh, spokesperson for the Sudan Doctors Network, thank you so much for your time.